Hello everyone, welcome back to my channel. I am Amit Lunkad and today going to discuss about the saline cathartics. Cathartics are medications that promote bowel movements. They are often used to treat constipation, and this presentation will explore the different types of cathartics, their mechanism of action, effect, and proper use. So let's begin with the saline cathartics. Saline cathartics, are also called purgatives, are agents that weaken and increase evacuation from the bowel. Laxatives are mild cathartics. Now, these cathartics are used to ease defecation in patients with painful hemorrhoids or other rectal disorders and to avoid excessive straining and concurrent increase in abdominal pressure in patients with hernias. It can be used to avoid potentially hazardous rise in blood pressure during defecation in patients with hypertension, cerebral, coronary, or other arterial diseases. It can be used to relieve acute constipation and to remove solid material from the intestinal tract prior to certain röntgenographic studies. Now here we discuss about the mechanism of action. So cathartics or purgatives generally act by four different mechanisms. Like first one is the stimulants, second one is bulk purgatives, third one is lubricants and saline cathartics. So you may also say there are the four types of cathartics like stimulants, bulk purgatives, lubricants and osmotic cathartics. So in detail we discuss one by one this mechanism of action. So first one is the stimulants. So these are the drugs or chemicals which act by local irritation on intestinal tract and bring about stimulation of peristaltic activity. As they act directly on intestine and stimulate peristalsis, they are termed as stimulant. Examples like drugs like senna, rhubarb, cascara, podophyllum, castor oil, aloe. Now about the second mechanism, which is bulk purgatives. So these are agents which are able to increase bulk of intestinal contents. These are cellulose or non-digestible polysaccharides. They swell when wet with increased bulk stimulating peristalsis. Example like methyl cellulose, sodium carboxymethyl cellulose, isabgol. So now next is about the lubricants. So in constipation, contents of intestine become hard because of absorption of water by body. There results difficulty in cleaning of bowels. Substances such as liquid paraffin, glycerin, mineral oils act as lubricants and cause smooth clearance of the fecal material. Last one is the saline cathartics. So these act by increasing the osmotic load of intestine by absorbing large quantity of water and thereby stimulate peristalsis. Poorly absorbable cations like magnesium, anions like phosphate, sulfate, tartarate are contributing to this effect. Saline cathartics are water-soluble, mainly inorganic chemicals, and they are taken with plenty of water. This is helpful in restricting excessive loss of body fluid and reduces nausea and vomiting. Generally, these saline cathartics can be used oftenly. So these are the four mechanisms by which they will produce the action. So in short, we can say that stimulant, these cathartics stimulate the muscles of the intestine, promoting contractions and movement of stool. Then lubricants means these are cathartics form a barrier on the stool, making it easier to pass through the intestine. Bulk forming means these cathartics absorb water in the intestine and increasing the stool bulk and promoting regularity. So these are all about the mechanism of action. Now there are some effects and side effects of this use of cathartics. So desired effect, it can be relief from the constipation. The side effect, it produces like diarrhea, abdominal cramps and dehydration. And long-term use can lead to dependency and electrolyte imbalance. So all these are about the saline cathartics. Mechanism of action is uses and some side effects. Hope all of you getting this. Thank you. Happy learning.